BMC bone mineral content. BMD bone mineral density. BMI body mass index. BMP blood metabolic profile. BMR basal metabolic rate. BMT bone marrow transplantation. BNO bowel not open. BNP brain natriuretic peptide. BO bowel open. B/O because of. BOA born out of asepsis. BOI born on island, i.e., a local patient. BOM bilateral otitis media. BOOP bronchiolitis obliterans organizing pneumonia. BP, blood pressure. Bipolar disorder. BPAD bipolar affective disorder. BPD biparietal diameter. Bronchopulmonary dysplasia. Borderline personality disorder. BPH benign prostatic hyperplasia. BPM beats per minute. BPPV benign paroxysmal positional vertigo. BR bed rest. Bathroom. BRA bilateral renal agenesis. Brady diet, bananas, rice, applesauce, toast, yogurt. BRBPR bright red blood per rectum. BRCA1 breast cancer 1, gene. BS, breath sound. Bowel sounds. Blood sugar. BSA body surface area. BSC bedside commode. BSE bovine spongiform encephalopathy. Breast self-examination. BSL blood sugar level. BT bleeding time. BTL bilateral tubal ligation. BTP breakthrough pain. BUN blood urea nitrogen. BV bacterial vaginosis. BVP biventricular pacing. BW blood work. BX biopsy. BZDs benzodiazepines. CABG coronary artery bypass graft. CABP coronary artery bypass procedure. CAD coronary artery disease. Cadacil cerebral autosomal dominant arteriopathy with subcortical infarcts and leukoencephalopathy. CAG coronary artery graft. Coronary angiography. CAGS coronary artery graft surgery. CAMP cyclic adenosine monophosphate. CAH chronic active hepatitis. Congenital adrenal hyperplasia. CAPD continuous ambulatory peritoneal dialysis. CAPS capsule. CAD computed axial tomography. catheter. CBC complete blood count. CBC/diff complete blood count/differential. CBD common bile duct. CBS chronic brain syndrome. cc cubic centimeter. cc chief complaint. Cardiac catheter. Carbon copy. CCCU critical coronary care unit. CCE clubbing, cyanosis, and edema. CCF congestive cardiac failure. CCK cholecystokinin. CCKPZ cholecystokinin pancreozymin. CCR cardiocerebral resuscitation. CCU coronary care unit. Critical care unit. CD Crohn's disease. CDH congenital dislocated hip. CDP cytosine diphosphate. CEA, carcinoembryonic antigen. Carotid endarterectomy. Cost-effectiveness analysis. CF cystic fibrosis. CFA colonization factor antigen. CFIDS chronic fatigue immune dysfunction syndrome. CFS chronic fatigue syndrome. CFTR cystic fibrosis transmembrane conductance regulator. CGMP cyclic guanosine monophosphate. CGN chronic glomerulonephritis. CH congenital hypothyroidism. CHD chronic heart disease. CHE cholinesterase. CHD coronary heart disease. CHE cholinesterase. CHF congestive heart failure. CHO carbohydrate. Cholesterol. CHT congenital hypothyroidism. CI confidence interval. Cardiac index. CICU cardiac intensive care unit. CIDP chronic inflammatory demyelinating polyneuropathy. CIN cervical intraepithelial neoplasia. CIRC circumcision. Circulation. Cis carcinoma in situ. CJD Creutzfeldt-Jakob disease. CK creatine kinase. Creatinine phosphokinase. CKD chronic kidney disease. CKMB isoenzyme of creatine kinase. CLL chronic lymphocytic leukemia. CMD cystic medial degeneration. CME continuing medical education. CML chronic myeloid leukemia. CMML chronic myelomonocytic leukemia. CMP complete metabolic panel. CMS chronic mountain sickness. CMT cervical motion tenderness. CMV cytomegalovirus. CN cranial nerves. CNS central nervous system. Crigler-Najjar syndrome. C/O complains of CO cardiac output, carbon monoxide, code chronic obstructive airways disease, COCP combined oral contraceptive pill, cold chronic obstructive lung disease, CONJ conjunctiva, COPD chronic obstructive pulmonary disease, CO2 carbon dioxide. CP, cerebral palsy, chest pain, CPAP continuous positive airway pressure, CPC clinical pathological conference, CPE Clostridium perfringens enterotoxin, CPK creatine phosphokinase, CPKMB creatine phosphokinase and myoglobin, CPP cerebral perfusion pressure, CPR cardiopulmonary resuscitation. CPT current procedural terminology. CR complete remission. CR creatinine. CRCL creatinine clearance. Crete creatinine. CRF, chronic renal failure. Corticotropin releasing factor. CRGN crescentic glomerulonephritis. CRH corticotropin releasing hormone. CRI chronic renal insufficiency. CRIT hematocrit. CRP C-reactive protein. CRT cardiac resynchronization therapy. CS cesarean section. CNS culture and sensitivity, antibiogram. CSA cyclosporin A. CSF cerebrospinal fluid. Colony stimulating factor. CT computed tomography. CTA, computed tomography angiography. Clear to auscultation. CTS computed tomography scan. CTU cancer treatment unit. CTX ceftriaxone. Contractions. CV cardiovascular. CVA cerebrovascular accident. Costovertebral angle. CVAT costovertebral angle tenderness. CVC Central venous catheter. Chronic venous congestion. CVD cardiovascular disease. CVI cerebrovascular incident. CVP central venous pressure. CVS chorionic villus sampling. Cardiovascular system. CVID common variable immunodeficiency. CWP coal workers pneumoconiosis. CX microbiological culture. CXR chest X-ray. DX or DS diagnosis. D55% dextrose. D5W 5% dextrose in water. DW dextrose in water. D-dopamine. DAEC diffusely adherent Escherichia coli. Daily disability adjusted life year. DBP diastolic blood pressure. DBS deep brain stimulation. DNC dilatation and curettage. D/C discontinue. Discharge. DCBE double contrast barium enema. DCIS ductal carcinoma in situ. DCM dilated cardiomyopathy. DD differential diagnosis. DDD daily defined doses. DDX differential diagnosis. DNE dilatation and evacuation. D-diethylstilbestrol. DEXA dual energy X-ray absorptiometry. DH developmental history. DHE dihydroergotamine. DHEAS dehydroepiandrosterone sulfate. DHF decompensated heart failure. D diabetes insipidus. DIB dead in bed. DIC disseminated intravascular coagulation. DILI drug-induced liver injury. DIP distal interphalangeal joint. DPT or DIPRTE diphtheria pertussis tetanus. DIT diphtheria tetanus. Dislocation. D/C or dish discharge. DIU death in utero, stillbirth. DJD degenerative joint disease. DKA diabetic ketoacidosis. DL deciliter. DLE disseminated lupus erythematosus. DM diabetes mellitus. DMARD disease modifying anti-rheumatic drug. DMD Duchenne muscular dystrophy. DNA deoxyribonucleic acid.